Hello.
Hi, happy Twin Tuesday.
Happy Twin Tuesday. Whoop, whoop.
Yeah.
Dr. Johanna.
Dr. Madeline.
And we are the awesome
chiropractors at St. Pete in St. Petersburg, Florida, at Atlas Chiropractic Center, where we see your whole family.
Yep. And our special jam, what we're really awesome at and love is our pregnant mamas and our postpartum ladies.
Yeah.
Yep. So we're definitely keeping y'all healthy through this crazy, crazy time. But we thought we'd jazz it up a little bit and talk about some different stuff today than everything else that's going on. Right?
I think everyone probably knows how to properly wash their hands by now.
Yes.
Right?
Yep.
Probably know how to properly wash your hands. Probably know how to sanitize everything in your home
Or office.
Keep space. You've probably learned how to do something super cool, maybe something new at this point on how to do your job from home or how your kids are getting schooled at home. So you're learning some new things. So I think kudos to y'all. Because
I know. Well, I've seen some patients that we have educate themselves on how to make masks. Because obviously, that's a big thing that the doctors need right now, are the masks in hospitals. So I also saw a patient that was learning how to make those. So that's a cool skill. So there's all kinds of cool stuff that's going on right now. You gotta.
Hey, Andrew. Dakota is at home trying to crawl right now, I believe, or bouncing or something. He's burning some energy.
And we'll actually, if you remind me, Dr. Madeline, maybe we'll post a video later of him crawling across the floor. He's getting crazy.
That's awesome.
He's getting crazy. Yeah.
Okay, so life's been turned upside down a little bit, right? We know that. We've all, like I said, we know how to wash your hands by now. I don't think you need us to cover that, and how to sanitize everything. You're probably learning some cool new skills because you're forced and challenged to, but that's not a bad thing.
Yep.
So, but what have we noticed? You told me something the other day, and I was like, oh man, we have to talk about this because I know other people are experiencing this.
I mean, through the past couple, basically the last week, I have noticed a couple of different things, but one thing that I've noticed that has flared up and gotten so bad for me is my jaw pain. Oh my gosh, I've been waking up with so much pain here, and I even go to open my mouth and I can only open a little bit versus the full amount in the morning.
Is that normal?
No, that's not normal. I mean, we're going to talk about how these things can become more inflamed during stressful times. That's common. But also on top of that, and I guess we'll talk about this a little bit, is even I was hanging out, I think it was on Sunday, and this is after a couple of days of waking up with this pain being worse and it being tight, and all of a sudden it locked up. I've never ever had that before.
I didn't know that part.
It locked up, and it even caused my eustachian tubes, my ears to compress, where it felt like I needed to pop, but I couldn't get them to pop. And I'll tell you later what I did, because we'll talk about more about how to get that to relax and stuff like that. But yeah, stress. Woo!
But before we get into why stress maybe influenced that, but I see this asked all the time. If you were having jaw problems, what does your ear have to do with it?
Well, everything's linked.
Oh. Crazy.
Yeah, so when, for example, if we would have a patient come in and they were having jaw complaints, because we do have some super awesome training that we have spent time to do on top of all of our other training on how to work and manage that. If someone comes in, I'm also checking their neck, because the neck movement and the nerves from the neck are what control the jaw, so they play together. So because your jaw joint is so close to your ear, all the structures inside, it's very intricate and connected, so they play together is basically what I tell people. And if one thing's off, it can throw a different thing off.
We're just a bunch of systems put together, essentially. So a lot of times if I ask people, if you have jaw pain, they're telling me all these other symptoms, and usually their other issues are going to be related to a lot of head and face and ear things, maybe some definitely neck, but maybe some maybe some shoulder stuff, because it is all connected and it works together.
Well, think about
So I
it.
just wanted to put that. Seed in there.
When you go to your dentist, a lot of dentists these days will screen for this kind of stuff, right? They'll ask you if you have any TMJ issues, so any popping pain, clicking in the jaw. They will also ask you if you're having any headaches, migraines, and some of them will ask if you're having neck pain as well. And those are really cool dentists, because those are the ones that usually will co-manage with us, so you can get the best changes as quickly and as the best that you possibly can, because there's all kinds of things we can do to fix this.
We got some cool holistic dentists that we like in St. Pete. So if you are local and you need a new awesome holistic dentist, let us know.
Yep.
When the dentist office are up and running again,
Yep.
we will get you in there. Okay, so everyone's extra stressed right now. Like, there's no getting around that. We know that. I did a live on a little bit on this earlier. Like, essentially in the matter of what probably seems like a day or an instant or a decision, like, everybody's life was flipped upside down. What we knew as normal is no longer normal. Whether we will fully go back to that or not, nobody knows. But what we do know,
let's throw out some emojis for stress, or if you feel like you're literally living in Groundhog Day.
Right? Like, it's like time is passing so slow, and it's like the same thing every single day, kind of a little bit right now, right? So I know I'm not the only one that feels that way. I know I have noticed increase in stress and anxiety within myself. We've seen it in our patients that are in here. We see it by people we are interacting with, because again, it's stressful to not know the like unknown, or not knowing what to do in this new journey and path we're on. But with extra stress comes extra stress comes with like flaring things up that are going on in your body. So stress is highly related to jaw issues.
Absolutely. So think about it. Like, if you are someone that does experience jaw issues, you probably already know that it is related to stress, because if you've ever like been in a fight, or you've been like obsessing over something that happened, because like we're really hard on ourselves and you just constantly think about that. If you wake up from a stressful dream, that emotional stress, you'll start to notice that clenching and that tightness happen. It'll become more often. In addition, what also will happen is physical stress and impact and injury, like a car accident, a fall, will inflame that as well. So different types of stress can cause that. And then chemical stress, are the foods that we eat as well, especially because like the foods we eat are twofold with the jaw. If they're too much for what's going on, it's going to inflame it. Like if it's too chewy, too crunchy, too chewy, it could inflame that jaw joint as well. So I notice mine more when I wake up in the morning, because I don't sleep as well as I used to, because I'll be honest, I'm still getting up several times a night with my little dude, and we're working. He's getting older, so it's getting a little bit better, but like I'm constantly like, I don't know how much sleep I'm gonna get, and my jaw tightens up. So that's one thing. And then also with everything that's just been going on in the world, I'm trying to do as many of the positive things I can to manage stress, but it's hard to disconnect from everything completely when it's affecting the whole entire world.
Right. So with that, a little rundown how it's all connected. Stress is going to increase if you're having usually like pain or tightness, and there's just certain like physical things that do get increased when we do have stress, like jaw tension and tightness. But we also realize right now why we want to talk with y'all today and give you some take homes and some different resources is because we completely understand that right now you might not be able to walk out your door and go to your doctor who helps you with this. That just might not be an option for you right now.
Right.
We realize everybody chooses to deal with their pain or symptom issues, diagnoses differently. Some people are taking medication to help with their jaw, and they are not able to get out the door and to go to their pharmacy and get those prescriptions filled right now.
Some people
what do you do?
Botox injections
you can't go and get
from their dentist to do that. And right now, at least in the state of Florida, and I think in most other states, dentists are not allowed to practice right now. Because of just what everything's going on with COVID. So there are other options, and chiropractors are still open, and we have to take the necessary precautions, which we absolutely are. And like there are things that we can do to help reduce that stress so it can feel better and get better.
What's one thing? Let's give them a tip right now that they can do, and then we'll tell you kind of some other resources that we have. So if your stress is increased already, we already know that. So we're somebody typically who has jaw issues, and it's worse right now because our stress is higher. Like we said, maybe you're not getting to your normal care that you would be doing for it. So what's one thing you can do at home right now to work on that stress?
Relax your jaw. Your teeth should not be clenched and touching.
Yeah, but like, how do I relax my jaw? You know what's a fun one? Everybody should do it, right? And you're at least going to laugh, because everybody needs a laugh right now. Laughter is good as well for your immunity. Like the horse, you go. It relaxes your jaw, though. Like, it does.
That's awesome. And if your jaw's relaxed, what else is relaxing?
Your pelvic floor.
Yeah, your pelvic floor.
You didn't think you could get through a live without us talking about pelvic floor, did you?
Not today. Not this Tuesday. So So that's a great exercise, and it does bring some laughter, which will release happy hormones instead of the stressful ones that can make things worse. So that's a really good way.
Yeah.
What's another like easy thing?
I think just like, well, right now, like top things we're telling you to do, some sort of movement or exercise is a good way to help manage stress. I know a lot of people get great results with that, with just their TMJ issues, their jaw issues, just with adding an exercise to their life.
And are you talking like physical exercise? Like, obviously we can't go to the gym, but
right.
like go for a walk or jog.
Yep, in the state of Florida, you can still go
whatever.
outside and walk on the sidewalks and stuff like that. So yeah, walk, jog, do something at home. I mean, you can do some air squats, you can do some push-ups. Everybody's been doing the push-up challenge.
Yeah, if you need some options, hit Dr. Madeline up. She'll let you know. I actually was trying to decide what I wanted to do for working out today, and I decided I wanted to go for a jog because with all this stress, I also feel like I'm breathing shallow, which makes that stress and anxiety worse because you're not like getting a full deep breath in. And I'm like, you know what? If I go for a jog, I'm gonna have to expand my diaphragm. And I did, and I felt way better.
That's awesome. So breathing in general is really good. So actually breathing properly and taking some like nice deep, what we call diaphragmatic breaths, which means we're breathing into our belly essentially. We're not chest breathing. So those are simple, easy ways that like things you can do right now to work on managing your stress at home.
Yes.
If, again, you're one of those people, you just can't get into your doctor's office, you can't go get Botox maybe from your dentist, you can't get your prescription medication you're taking to help with your jaw, we do have an online course as well that shows you exercises that you can do at home in a couple minutes. And all the patients that have been using, the people that have been on it, have said great results that like it's letting their attention go, they're decreasing their headaches when they do it, they're getting rid of the headaches super fast, and all in less than 5 minutes.
And it's releasing the tight muscles in the jaw too, so it's reducing those symptoms. And that's what I did on Sunday. Right, that's what I did on Sunday. I did that course. So it's so good that we're doing it at home. And right now in a world that like we can't go out as much, or if you don't feel comfortable coming into the office and all that stuff, this course is for you. I mean, it's amazing.
Yeah, so we have that on there. What I did, and I also have a new other course up there too we can tell you about. Anyhow, what we did is right now I understand times are unknown, we're not really sure what's happening, so I am giving it to you for 50% off, but that does require a special code.
Okay.
So if you're watching this, you're going to either message us or you're going to comment in the comments that you want the code, so say code, and I will make sure I get you the code so you can use it and get it for 50% off right now. And but it will make a big difference. It's something that empowers you to actually take action when this is happening, so you can actually get out of that like pain cycle faster. You can help calm those tissues down. And this is something you can use even past when we get back to our new normal life.
Yeah,
which
absolutely.
is awesome. We're all about empowering our patients here, so it does give you tools that you can actually use on your own.
And I know some things that you've heard from patients or other clients that have taken your course or things like they have been even able to avoid taking medication or avoiding Botox shots and avoiding different things that they may not have actually wanted to do anyway because it got them relief that they were looking for.
So it's just an option that you have on the table, so we can support you through this time. If you are local, we are still open. As we talked about, we are screening patients, new and current patients constantly. We're constantly following all protocol like we're supposed to be doing.
And I want to say that information on the protocol and what we should be doing, that's coming from our state board, from the state of Florida, and it's coming from our malpractice insurance. So if we weren't able to do those things, we would not be providing care, but we are going through and we're doing the things that they told us we need to be doing to be compliant to see you guys. And the one reason I know that we're still doing that is because, like, I know Dr. Madeline and I had a conversation, and we have had patients over the past couple of days come in that have been in so much pain and they can't go to the hospital. And when their normal response would be go to the hospital and get a medication or muscle relaxer or something like that, they can't do that because everything's, all shut down, and it's, what they absolutely only necessity into the hospital right now. So chiropractic plays a big role in that because it can help alleviate those pains and discomforts with some treatment.
And I've seen way too many posts and groups that I'm in about, and if you've ever had spine pain, and TMJ pain can be spinal pain because that nerve gets inflamed. I've had spine pain before, and it hurts, and it sucks, and if you've never had it or you don't understand it, it's scary. And I've seen way too many people post about kind of just being like at their wits' end with the pain, and kind of at a point where they talked about like being so dissatisfied with life and suicidal. So then if you're not even having an option to go into your normal process of maybe a doctor or urgent care or something like that, if that's not an option for you right now, we want you to have resources so you don't feel alone and you don't have to go down that path. We have free stuff. We have some other stuff that's discounted right now, and we are still open if you are local. So we are here to serve you.
Yeah.
If you have questions, you're not sure where you fit into that, you're not sure if you're comfortable with office, not like whatever, just message us. We're more than willing and welcome to have a conversation with you. Not a problem.
Yeah, and the cool stuff is that even if you're not local and you are experiencing this jaw or neck pain or headaches, the course is online, so you can be anywhere literally in the world and utilize the course. And also, if you decide that, hey, I do want to do that, but I also want to get evaluated by a chiropractor so I can get this resolved and someone that's going to work with my dentist and we can be a power team, reach out to us, because if you're not local, we know those chiropractors that have that additional training, that have the very specifics on how to measure the jaw, how to palpate the muscles, how to determine where the misalignment is and what type of treatment needs to be provided. We have resources to find those people in your area.
Yeah, so we're here to help you.
Yeah.
Keep staying healthy, keep washing your hands. If
Yeah.
you're watching this and you're like, actually not sure how to wash my hands correctly, let us know. We'll put out a video on that too.
Fun.
All right, we'll see y'all later.
Have a good one.